Shh. The podcast is starting. Welcome to the OT Download, from practice to podcast. This is where we unpack everything you didn't know you needed to know about occupational therapy. Whether you're an OT, an OTA, a student, or simply curious, this is your place to explore the real stories, challenges, and opportunities shaping our profession. Each episode will dive into fresh topics from ethics to AI in practice, to the dynamics between OTs and AHAs, the differences between community and medico-legal work, and even what it's like stepping into the courtroom. You'll hear honest conversations on mental health, well-being, boundaries, and early career experiences, alongside insights from lawyers, allied health professionals, and other experts. We'll bust common misconceptions and shine a light on the parts of OT that don't always get spoken about. So if you're ready for insights, stories, and a no-nonsense take on occupational therapy, this is your download. Let's get into it.
Welcome to episode 3 of the OT Download podcast. My name is Mia. I am a medico-legal occupational therapist and team leader of our medico-legal team here at MLEA. I have been an OT for a little over 5 years, and my route or pathway to find medico-legal, if we go back to when I finished uni, my first role was in vocational rehab or return to work services. I worked in that position for about a year and then ended up transitioning into a couple of hospitals in Brisbane and worked across a number of different acute wards and inpatient rehab wards and outpatient rehab for about 2 and a bit years. And at that point in my early career, I suppose I was looking for a different type of challenge, and I was looking for a role that aligns a bit closer with my personal goals and personal life in terms of needing a bit more flexibility, given that my family live overseas. And yeah, I saw a role for a medico-legal occupational therapist. I had no idea what it entailed. And eventually, 2 and a bit years later, that's led me here to working as a medico-legal OT for MLEA. What about yourself, Callie?
My name is Callie. I work as a Medicolegal Client Services Officer. I guess that just means I'm behind the scenes, just managing clinical communications, but also, working quite closely with the OTs, but also with our referrers, which is really exciting. I came into the role not really knowing what to expect, and I think we'll kind of touch on those sorts of things today about what it actually is to work in a medical legal OT role in the clinic and that sort of thing. But yeah, definitely didn't know what to expect, but it is just, it's a great role, great company, and I can't wait to kind of get into the nitty gritties of it.
Well, on that note, so we'll get stuck in. So I suppose for our listeners, if you've ever wondered what medico-legal actually involves, what it looks like, we're going to be lifting the lid on that today. Or whether you are wondering whether it is really like an episode of Suits, this episode's also for you. So let's get stuck in.
Wonderful. Let's start with, what is medical legal OT?
Medico-legal OT, I would say, is when a claim, typically not always, but is generally finished sort of the statutory phase. So that's when someone is much earlier on in their claim where liability or causality isn't being investigated or established, and the claim will then shift into the common law phase. So that's when we will generally see someone when they might present to a lawyer and ask for advice or whatnot, and we really work in the personal injury space of claims. So motor vehicle accidents or work injuries, public liability, medical negligence or dust diseases and things like that. And it's really, for us, it's about assessing someone's function and how their function then impacts their capacity in a range of different settings, whether that be their work capacity or their capacity for home duties or whatnot, and then informing what that means for their future needs as well. And I guess the other thing we should mention is obviously majority of the claim types that we do within the personal injury space. So, you know, when you think about the legal industry or setting, there's a number of different practice areas, just like OT, you know, family law, civil law, whatnot. But the area that we work in is the personal injury space.
And for our listeners who might not know, that could be like medical negligence claims, they could be motor vehicle accidents, public liability. So you might be looking at slip and falls, trip and falls, those sorts of things. Anything kind of work cover related or work capacity, those sorts of things.
Also, probably less common but still relevant, like dust diseases.
Yes.
And
institutionalized abuse.
Yeah. So they're probably some of the most common like claim types or referrals that we might see. Obviously, there's a number of different types of reports as well. And whether that be like length or different things that lawyers might come to us and want assessed or reviewed. Like from your perspective, Cal, do you want to maybe talk us through what that looks like when someone might literally initiate at the time of their booking what they might want or what sort of the specifications might be?
Yeah, absolutely. When we receive a referral, we are most often looking at, well, what the claim is. So it might be that there's multiple injury sites, quite complex injuries as well. You might be looking at TBIs, brain injuries, amputation. That all kind of warrants a comprehensive report type. I think the most important thing about our reports is what we are assessing. So whether or not we're assessing for work capacity, past care, TPD,
dependent care.
Dependent care as well.
For listeners who might not know what dependent care is, say if due to someone's injury or illness, their capacity to provide care to dependents, whether that be, you know, their children or potentially like maybe an elderly parent that they're a full-time carer for is impacted, then some solicitors may ask us to quantify the level of impairment that has occurred as a result of their impaired ability to care for that dependent, and then also provide the equivalent like commercial care cost of that as well to go towards someone's claim.
Well, can you think of like a case of your own where you have kind of, I guess assessed for maybe both past care and work capacity or any sort of functional need?
Can I ever? Can I ever? Yeah. In terms of like you're saying before with those more like comprehensive reports where there's maybe a lot of like complex factors going on. You're saying before, like the example for like brain injury and amputation. Like I had a gentleman not too long ago who I visited up north, who had been in a motor vehicle accident, and he'd had like a right transfemoral lower limb amputation, like traumatic following the accident. But he'd also suffered like traumatic brain injury, vision injury as a result of his brain injury, and potentially, you know, understandably some other psychological symptoms going on. It wasn't diagnosed, but understandably he had that complicating it. So that was a report where obviously like a huge amount of loss for him, both in care and, you know, potential employment capacity. So that was one where we assessed work capacity, past care needs, and also future care. Part of what we do is also about like forecasting with someone's condition and with their circumstances, like what kind of care or equipment or therapy they might require in the future. So then the solicitors are able to accommodate for that cost and the compensation as well. So that was like for that gentleman, like all the things that we did for him. There was like so much going on in that report, because not only did he get care from like his family, but then there were other paid care services that also provided care. Alternatively, I also saw a lady quite a while ago in Cairns actually, and she had also had a motor vehicle accident. She was a lot younger, but she had, at the time that I saw her, had like a 6-week-old baby. So I think her injury had happened, I don't think she was pregnant at the time of her injury, but shortly after she became pregnant. And then at the time that I had seen her for her assessment, her baby was 6 weeks old. So then the solicitor had requested dependent care assessed, but then also asked like for future childcare recommendations that this client might require, because she isn't able to like care for the child herself as a result of her injuries. But then trying to forecast like all the way up until the child is 18 years of old to know what they might need. And I think that's just like we were saying at the start, when you just have to come back to like evidence-based and, you know, resources about typical developmental timeframes and that kind of thing. But they're probably two reports that stick with me in terms of just like complexity and like probably ranging the scope of practice that we can apply within this role,
Yeah.
I feel.
Yeah.
So what I wanted to ask you about next, Callie, is I think a misunderstanding that a lot of people might have about medico-legal practice, and that is often when people hear that I'm a medico-legal OT, they'll say to me like, oh, so you work for a lawyer, or like, oh, so you work for an insurer, or one party or the other. So I wanted to talk about that a little bit more.
Yeah.
So I guess like whether it's me when I'm seeing the client themselves, or whether it's like yourself when you're taking inquiries and responding to different people,
Yeah.
what's been like your kind of experience with that, or even when you tell people the area that you work in?
Yeah, absolutely. I mean, I was at an event just last week, and a lawyer who doesn't even work in personal injury, he actually works in family law. He was like, oh, yep, so you work for the law firm. And I was like, ooh, no.
Yeah.
No, because
Yeah.
technically, you know, the whole thing is to be objective,
And
unbiased,
impartial.
yep,
Yep.
third party, independent
Yeah.
medical examiner. So, yeah, no, definitely we don't work for the person. It's more like we are contracted out, I suppose, is
Yeah.
the way to kind of make it.
Or not even like, I agree, yeah, we definitely don't work for one party or the other, but it's almost like, yeah, we're independently engaged in our own bubble. But I think just with chatting with other health professionals who actually work in the medical legal space, not allied health though, more like medical specialists, they also thought that you and I were employed for a solicitor's firm as well. So, and that was coming from someone who also did like independent medical examinations themselves.
Ooh.
I know. So I feel like it's a really common misconception people have about what we do.
Is it how we're wording it? What are we doing wrong?
I don't know. Maybe it's not us. It's not you, it's me. No, I don't know. But I feel as though that's one really common misunderstanding people have.
Absolutely.
Are there any others that you've come across, like working in this area?
I mean, I think this is one that you might be able to touch on. It's just report writing.
Yes.
Yes.
Yes, I've heard this before. I think it's obviously so much more than report writing. Like, you know what we do, but I think it's, where do I even begin? I feel as though obviously before we even see the person, I think you have to have a really good knack for like critical thinking, because obviously when we review the brief, so like the brief of evidence is all the documents that get sent to us before the
Treatment
assessment, just for those,
records.
yes, report writing's one thing, but generally our assessments, no matter whether it's like you're talking about before standard or comprehensive reports, regardless, our assessments can go from anywhere like 2.5 hours to, like, I've had some go up to 4 that have been really full on. The plethora of skills that you need within that assessment, obviously extremely good communication, rapport building, empathy, respect, all those like just general human competencies, I suppose.
Yeah.
It's not like you can just like go on all day or like call them back if you need something else. Like, you need to be very efficient with your time and prioritize like what information you need at that time. And then, yeah, of course, report writing is a large part of what we do, but I feel like it definitely doesn't capture like the whole picture.
Yeah.
Yeah.
I think it's just other people thinking, oh, this OT is just sitting at her desk and you know, making all sorts of assumptions and opinions and just smashing out reports. And yeah.
I do sit at my desk and I do smash out reports, and when required I may make assumptions within, you know, what's reasonable, but it definitely doesn't capture the whole picture of what we do.
Whether we're plaintiff or defendant, it's all about actually assessing the client and making a very real world examination.
Yeah, totally.
Yeah.
Another one that I've had people tell me when they hear that I work in medical legal is like, oh, that must be really dry, or oh, that must be very like disconnected from the patient or the client itself. Like, I know you don't assess people, but still you talk to a lot of our clients on the phone and you talk to their referring solicitors as well. Like, what's your opinion on that sort of perspective?
I would say no day is the same.
Yeah.
Because no condition.
Amen.
Yeah. No condition is the same. No actual claim is exactly the same either. Like, someone might have really intense prior medical history that might make them a bit more, I don't know.
More complexities in general.
Yeah. So there might just be different things, different behaviors as
Yeah.
well. Obviously, the assessment types as well can change. But also assessment location.
Yeah.
I mean, everyone's traveling
Yeah.
all over the
Well,
place,
that's-
all over Australia, home visits, in-clinic, video conferences, you
Yeah.
name it. So nothing is
Callie
really the
is
same.
busy. We keep Callie busy. But we didn't mention that. Like, we also travel for our
Yes.
job, right? So
Exactly.
like, where's some places we travel? Cairns, Mackay, Bundy, Rocky, Darwin. And then everywhere in between.
Yeah. I think anything human related can never be boring.
It can never be dry.
It can never be dry.
I would say, I would say it's full of life. I feel, well, that probably links into an experience I had. So before I actually started this position, I was working in a hospital, and I had recently resigned from that hospital position to obviously take this role on full time. And I remember telling a colleague of, I've actually resigned, like, just wanted to let you know. And then they ask, where are you going? What are you doing? And I said, I'm actually doing medico-legal OT. And I think it's such a niche. It's why we're doing this podcast, right? It's such a niche area that people don't really know a lot about.
Yeah.
But their response to me was, oh, so you like writing reports more than you actually like helping people. Which was,
Oh my gosh.
yeah, it was a bit of a punch to the gut.
Yeah.
However, upon reflection, I think that's also, just a reflection of maybe their limited understanding of what it is we actually do. Because in no means at all do I feel as though what we do is disconnected. Like, every single client that we've seen, whether it's plaintiff or defendant, has gone through, something horrible and a really traumatic experience and deeply disturbing at times experience of their life. And generally, like you said, by the time they see us, it's towards the latter half of their claim, towards the end. And so they've been going through this journey for however long, like years and years. And I feel as though because our assessments are so long, 2.5, 3, 4 hours, it actually gives people a lot of space and time to express, all the intricacies of how this has impacted them really, really deeply. And, it's part of the reason I love OT is that we get to find out like so much about people. And it's like, I think it's a real privilege to be able to get to know people on such a deep and personal level. And so, when that person said that, I was sort of like, well, that's them, that's their opinion. But I think even after starting this role and working this role now, like, in no way is it disconnected from people, because that like the report you write can make a huge difference to someone's claim.
People are relying on you
Yeah.
to be objective, to
Yeah.
actually look at their pain rather than just say, tick, done,
Yep.
send you on your way, never
Yeah.
going to see you again anyways.
Yeah,
like, you actually
exactly.
have quite an onus on you to be aware of all of the details.
Yeah, and I think it's a real privilege.
I reckon too.
Yeah.
So I think on that though, do you struggle ever to balance objectivity and empathy?
I don't struggle, because I think I can have empathy for people and still be objective. I think I don't think they're mutually exclusive. I think you can still have feelings about someone and about what they've gone through, but still provide an objective opinion. And I think that partly just comes with experience and clinical reasoning, because at the end of the day, like, we're all human. And I think if you don't feel something when you talk to someone about a really traumatic experience they've been through, then it's probably not the right job for you.
Absolutely.
Yeah.
Yeah.
If I'm giving some hurtful, hard truths, that's how I feel.
Mia,
Yes.
that sounds like a lot, to be honest. Holistically, you're assessing a lot. Can you go into a bit more detail about what a typical day in the life of a medical legal OT is like?
For you, I definitely can. So there's like a heap of different components to it. There's this pre-assessment preparation. So we briefly mentioned it before, but we generally will set aside a few hours to review the brief of evidence that the solicitors send us. So that will include all those records that we mentioned before. And from there, it's basically pulling out what are the sort of the key compensable injury areas or sites or conditions that we want to assess. And from there, picking what kind of questionnaires we might want to administer or assessments. And then of course, like the actual assessment itself. So we said before, they're extremely thorough, like really in depth, and in the usual referrals we get, you were saying before, you know, that's like work capacity, assessment of work capacity, but also past care requirements. I usually say to those clients when they arrive, when I'm explaining what it might involve and how long it's going to take, I usually say, you know, there's 3 parts to the assessment today. The first part is going to be us getting a really good understanding of your physical, you know, psychological symptoms, what kind of treatment modalities or medications you might be undergoing, what sort of your different postural or functional tolerances are for different movements. And then we also might do like the actual physical testing, right? So range of motion and manual muscle testing. We also do like a dynamic lifting assessment as well to get an idea of their strength capacity. And then we transition onto the work capacity section. So that's when we talk in a lot of depth about like education and employment history, qualifications, certificates, all of that kind of thing, like computer literacy, general literacy. And we'll talk about prior to the date of the subject incident, what their work was like. So, you know, like how many hours were they working? Where did they work? What were the duties like? And with that, if it's a physical injury, what like were the physical demands of that role? Because obviously like the physical demands of an accountant are going to be completely separate to the physical demands of like a cane farmer. And then after their injury, pulling out a lot of the really in-depth changes that they might have experienced from a employment perspective. And then finally, generally the last portion is when we assess like the past care. That can obviously take a lot of brain energy for the client, because obviously we're basically going back rewinding all the way back to when they had their injury and then up until the date of our assessment. And we almost have to establish a timeline of how their function has changed and then quantify the care that they've required for a number of different things, pretty much into hours per week. So if someone's been, in, out of hospital a lot for surgeries or admissions or whatnot, generally then their care requirements have changed and gone up and down. And so it can take quite a while to assess all that. So that's just the assessment, Cal. So that's a quarter of the fun. But thereafter, obviously we write the report. Or post-assessment wise, touching base with the solicitor to let them know that we've finished the assessment. We'll also sometimes follow up like the day after with the client to check in. Yeah. Because their pain on the day of assessment might be very different to what it looks like the day after or, a couple of days after. And then from there, we get stuck into basically formulating and finalising all of the details that we spoke about in the assessment. So all of those things, I don't really know how else to explain it, but we take all the things from the assessment and we make them pretty and objective and justifiable and balanced, and we write a really detailed, thorough report from them. So write the report. And then from there, it's really goes through like a quality assurance process. So you would obviously know with all of our reports, they go through like a cross-editing process where another expert or clinician will read them to really just make sure that we have crossed our T's and dotted our I's, and there's nothing that I suppose we've missed or haven't thought about. And it prompts you to think of it in an entirely different way. Which, I mean, you might not always agree, but it is really important for you to sort of think about it and actually say, okay, like if I was asked this question in court, how would I respond? And I guess in terms of being asked that in court, like people might hear that and be like, oh my God, you go to court? Like what? But only in reality, I think in Queensland, it's something like 2% of cases actually progress to the court phase of us having to actually give evidence.
Yes.
Because it sounds scary, right? But it's actually not that common.
Exactly.
Yeah.
It's less than 2%, which means 98%. I mean, my favorite thing is when you do all of the work and there's pre-conference trials and that sort of thing. And, you're doing all your meetings and you've booked it all in. And then
at the 11th hour.
The day before, if we're lucky, maybe 5 business days before.
Yeah.
But sometimes the day before, day of, we'll just be told it's settled. It's no longer going ahead.
You're no longer required as an expert witness.
Yeah, exactly.
Because
Pack up, go home.
Yeah, exactly. But in terms of a day in our life, that's probably the key parts of what we do. But we also do, I guess, outside of our normal role, like MLEA is really big about education as well, and educating not only other OTs, which is, you know, kind of why we're doing this potty, but even like just other parties as well, like our referrers. So we do like education sessions about what our role is as a medical legal OT and our processes and things like that, so we can empower other people to have a better understanding of what we do. So,
but yeah, was there anything that I guess surprised you about your job?
Like starting in medical legal?
Yes.
Yeah. I think I've said this to a few people in our team, but coming from a hospital environment where, like, certainly there were some doctors who really appreciated what OTs brought to the table. But in my experience, there were also times where, and I think it's much the same in NDIS, and I think like Janelle, Em and Katie would have talked about it in the first ep, but there's times where in the hospital, like I was really having to fight for your profession and like fight for your position as an OT and really advocate for why you should be involved in someone's care, particularly on an acute ward where you're only allowed to see someone once you've physically been referred to by that treating doctor. And so you might hear like collateral information from the physios or whatever about, oh my gosh, this patient needs OT so much. They live in a home with 3 flights of stairs and they're a hoist transfer currently. And you would say, you know, hint to the doctor or the nurse unit manager, like, oh, hey, so does this person need OT? And they'd be like, what's OT going to do? Or, no, I'll let you know when they need OT. So you're constantly having to be like fighting for your profession.
Goodness, yeah.
And I guess at times like NDIS is the same, you know, when like our colleagues like at MLEA are putting forth recommendations for equipment or increased care hours, and NDIS might say like, no, they don't need it, or whoever might say no. And so you're constantly having to give that fight, I guess, as to why your role is warranted. But I guess what shocked me coming into this is I truly do feel like the referrers that we work with, you know, whether it be like plaintiff or defendant, really do appreciate our role and what we bring to the table, because like we were saying before, like a report from us or an assessment with us can really impact the trajectory of someone's claim or what their compensation is like. So often they're so appreciative or value our opinion.
Absolutely. I mean, so many times we can hear, oh, yep, in our mediation, or yep, in our conference, it was the OT's report that swayed the other side.
Well, yeah, that. And I also just find it super rewarding when you might get feedback to say like, you know, oh, like I read your report recently and I found it really fair is a really, like, I really love when people say I thought it was very fair or really well justified or carried a lot of really good detail. Like that makes me really happy, because I think that just shows that we are, you know, really objective and impartial. But yeah, I think that's probably the thing that surprised me the most is just how appreciated and respected our profession is in this scope of practice, because yeah, it's, in my opinion, you're never having to fight for why someone should be getting an OT assessment or like an OT review.
Absolutely.
Yeah.
Definitely warranted.
And that's the tea. No.
So I guess you've kind of mentioned how in your medical legal OT role, you're a lot more authoritative and you're a lot more respected, I guess, in your niche way that you can actually assist claims, which is incredible. How would you say medical legal OT is different from clinical OT?
I feel as though in the traditional sense of clinical OT, whether that be community-based or hospital-based or whatnot, your role is really centered around your intervention, right? So whether that be, you know, your therapeutic intervention may be recommendations of equipment or home modifications or actual hands-on therapy with a patient, whereas I feel as though for us, our intervention per se is our assessment, and our intervention is the recommendations provided in the report based on our assessment. So I feel as though the assessment really forms like the crux of, I guess, your intervention. Even though it's not hands-on therapy based, it's still an intervention of a different type to support recommendations.
Absolutely. Yep.
And I feel as though the other really big differences in my mind is often, not all the time, but particularly like because a lot of my experience was in like an inpatient rehabilitation setting in the hospital. So that's where, I mean, the setting I was in was designed as an intensive short stay rehab. So average length of stay was like 2 weeks plus or minus. But you would see people every single day for an hour for therapy. And so you're therapeutic relationship is obviously like you get to know someone really well, especially if we had patients who were there for longer than that, like 4-6 weeks. You're seeing them every day for an hour. So I'd say like the therapeutic relationship is a lot more protracted. But I feel like in medico legal, it's almost like condensing all of that into a space of like 3 to 4 hours.
Absolutely. And we wish we could keep the good ones.
Yeah. And I feel as though Katie and I joke about it all the time, but obviously, as is with any role in OT, you meet such a wide scope of people. You always have to, just be really good at relating to people about a number of different things, or like matching different people's personality. But I feel as though in medico legal, you have to be so good at matching the vibe, like straight up.
Absolutely.
You would know it too when we have clients walk in and they have different personalities and whatnot. You just got to match the vibe, because you literally only have 3 hours to rapport build and get all of the information from that person that you need. You almost get quite good at, I don't want to say profiling, but you almost know, the more you do it, as soon as I feel like within the first minute of talking to someone, you kind of know how the assessment's going to go.
Yep.
And you just have to be very reflexive to be able to just think on your feet and be like, I'm going to have to restructure my assessment like this. I'm going to have to just take this out because I know this person won't maintain attention for that long, kind of thing.
Yeah.
Obviously, the other big one is like just the language we used. Like inter alia. I'd never heard that phrase in my life before this job. And preponderance, convalescence, all words that I have learned.
Legal jargon.
But also just the style of writing is extremely different from, I'm sure, a lot of other contexts. But in a way, I mean, in hospital notes, like clinical charts, for me personally, like you generally have to try and make it very short, sweet, objective, to the point, because doctors are not going to read pages and pages of writing.
Yes.
And also you don't have the time.
Yeah.
And I think that in a way did help me coming into this role to be very like punchy and to the point and objective with what you're trying to say. But like for example, we always try and avoid like absolute statements. So we never say like Mr. X is unable to cook, because like, well, have you seen him cook? Like, how can you definitively say he's completely unable to cook unless he, I don't know,
I guess
doesn't have arms? So always saying like is restricted in his capacity to, or experiences ongoing limitations with. So you just have to really rephrase the way you write as well, which I think is very different from a lot of other clinical settings.
And so all of that to say, what is the actual impact of what you're writing? What is the impact of your reports that you're producing?
Yeah. Well, I think, I mean, a major one is obviously the compensation that someone will get from settling or from going to court following their injury or incident or illness or whatever. So we were talking before about past care. So, getting an actual quantifiable amount of how much the care that, say their spouse gave to them, how much that would cost if they were to get that same level of care from Blue Care or whoever it might be, a commercial provider. And that will then, generally go towards increasing their claim. But also I feel as though we see a lot of people who have gone through this protracted, drawn out treatment process, but by the time they've seen us still haven't had what I feel as though is like basic or enough targeted treatments. Like I saw a lady the other day who'd had a motor vehicle accident, had bilateral ankle fractures. One of them was really severe. She'd had a lot of surgery on it. And when she came in to see me, had this like moon boot on, took her moon boot off. Her ankle was so swollen, and not just like deformity structurally, like actual a lot of edema and just accumulation of swelling. And I sort of said to her like, oh, have you ever seen an OT about potentially getting like a custom made compression garment made or something like that? And she didn't even know we did that, like didn't even know that was an option, had never seen anyone. And it was actually impeding her movement in her ankle because it was obviously the orthopedic injury was, but also the swelling was. Yeah. So being able to like make those recommendations as well for therapy that people maybe haven't got yet, which could improve their function, is another really good, separate to obviously the financial aspect for people. That's also a really good part of what we do. And also like getting people home mods who maybe haven't had home mods yet and who are just like really struggling at home. The things you see as an OT with people getting in and out of the shower and whatnot, like, yeah, I think that's really meaningful as well.
Absolutely. You know what I'm just hearing? I'm just hearing a whole awful lot today, Mia. So would you say that this is all emotionally draining at all? Would that be wrong
Are
to
you
say?
finding conversation with me emotionally draining? No, I'm joking. I'm joking.
I've been sitting here a while.
I can see you nodding off. No, I'm joking. I think that you're right in saying that a lot of the stories we hear and our interactions with clients, it can be heavy. Like as with any area of OT, right? It can be really heavy. I think that honestly, if I was to speak candidly, I think it just comes with experience, being able to set pretty healthy boundaries for yourself. And I think you have to be able to, and not to minimize the impact of these situations and injuries, but you have to be able to compartmentalize, because if you don't, like, that's when things get really heavy. But I think setting really healthy boundaries for yourself, but also having like really good supports in place. So you and I will quite often have a post-assessment debrief at the office, as will me and Katie. Like
over a cheer up choc.
Yeah, over a cheer up chocolate. So I think it's about, having those strategies in place that you can go to people who understand what you do, to be like, oh my goodness, that was so intense.
Yeah.
I don't think it's a weakness though. I don't think things being emotionally draining should be looked at in a negative way, because again, it means that you care and you are really understanding the gravity of the situation.
Exactly.
Yeah.
Yep. What key attributes do you think a medical legal OT requires or necessarily needs?
If I was to give you a quick summary, I would say a nice breadth and depth of clinical experience. I think an ability to use a lot of clinical judgment and reasoning, both in clinical terms and non-clinical skills as well, like reading documents. An ability to have empathy for people, which all OTs should have, but I think it's
all
worth
humans
saying.
should have.
Yeah, absolutely. And like any role, I think this is a position where you really need to be able to think on your feet, in terms of be flexible with what you're doing on the day, and also just be able to prioritize really well. So if you have a set 2 hours to get through something, you know you're not going to get through everything. What takes precedence?
Absolutely. So you're basically saying you need to be a superhero. You need to fight for what's right in your OT space.
Yeah, I think you need to be able to have an innate want to help people and do the right thing, basically. And I guess the whole reason we're doing it is to achieve that sense of justice, whatever that might be. And so being objective in our role can help achieve that.
And it means something. It means so much more than people even think.
Yep.
Yeah.
Yeah, totally.
So do you think that medical legal OT is strictly for older OTs or highly experienced OTs? Like, what sort of OTs would you find in the medical legal space?
Well, I do think it's important to have some sort of clinical basis, or like bread and butter understanding of OT. Not to say that you need to have like 10 or 20 years experience before you go into medical legal. We do, ideally, when we're looking for people to build our team, we might, say it's highly preferable, or, ideal if you do have, say, 3 years clinical experience. It puts you in really good stead when you do come into the medical legal industry, where you're seeing clients from all different types of injuries. Like, I can't even, it's like orthopedic, musculoskeletal, neurological, terminal, like oncology diagnoses. So it really helps to have that breadth of experience. And whether you get that from hospital, whether you get that from community, I think it's still going to put you in a really good position to do medico-legal work. Because, it just gives you exposure and experience, and with that, more confidence to be able to make, your clinical judgment and your opinion as well. So while I think, yes, it's important, I don't think it's like the be all end all, I suppose.
Yeah. Just largely something that needs to be considered,
Yeah.
especially since you are the expert of your field.
And I also think like clinical experience is one thing, but at the end of the day, I also think there's sort of there's maybe personal attributes as well that make up a medico-legal OT. I think you have to enjoy being very critical in your thinking and very I would say methodical in how you analyze evidence or how you analyze a situation. And I say to people, I feel as though 90% of our job is like taking in a situation that's just like grey and muddled and the water's murky, and then trying to very clearly distinct it between like A, B, or black, white, or, you know, what you think's reasonable and not. And that can be really challenging. But I think having, that really like critical lens of thinking is also really important. And, you know, some people enjoy that, or some people have that. And I just think some people don't, like, that might not enjoy that type of thinking as well.
All right. Next on the agenda, rapid fire, true or false?
Woo!
Ooh, and I'm going to kick us off. All right. First one.
Yes.
OTs, medical legal OTs, just write really long reports.
Ba-bow. Well, partially ba-bow. I feel as though we do write long reports, but there's a very important reason behind it. They're all really evidence-based. It's objective, and it's based on like weeks of functional analysis, assessment, collaboration, like cross-referencing. So they're detailed, but I'm proud of the fact they're detailed because they need to be.
Anyone can write a medical legal OT report.
Flat out false. Flat out false.
False.
I think if anyone takes anything away from today, I would hope it would be the fact that it's a very specialized discipline of OT. And that's why I guess it is so niche and not many people know about it, is because it does require, I feel, a very set domain of skills and just experience and like breadth of knowledge as well. I definitely don't think it's a fair assumption to say anyone can just like waltz in and write a medical legal OT, because not only just is the clinical experience part of it, but just that person's attributes and skills, non-clinical skills, I guess, like we were talking before, like critical analysis and thinking and judgment and reasoning. All of those things are very important. So I think it's something that needs to be developed and honed over a long period of time.
Because it is the intersection of medico-legal.
It's the junction, Callie.
Yes, absolutely.
Yeah, so I would say you're false.
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 All right, I'll take that on the chin. What about, I guess, the myth that you can't care about your clients if you are objective?
I say that's nonsense. Absolute rubbish. I think another unique skill about what we do is being able to like hold room for compassion and critical thinking at the same time. I think I was saying before, like, they're not mutually exclusive. Like, just because you care and you're empathic for someone doesn't mean you can't be objective in your opinion.
Exactly, because you're folding on yourself.
Yeah.
You're basically saying, oh, yes, my opinion doesn't hold weight here.
And I think there's also a way to do it, a bit of a nuanced way to do it, where you can like put forward your opinion and what you think is objective while still acknowledging, you know, maybe the hardships that the client's reported to you. Like, you're not discounting them altogether, but you're saying like, yes, whilst I understand Miss X experienced XYZ, I still think that this is justifiable or reasonable or whatnot.
Yeah,
so
it's put into perspective.
Yeah, and I think, like I said to you before, I think if someone's walking into a room and they're like blinders on, just looking at what's objective and not actually like taking into account the person, which is the core of OT, I think you're probably not in the right profession.
Yeah.
Yeah.
Absolutely.
Okay, Cal, what about if someone was to say to you, well, the lawyers just tell you what to say. You work for them anyway, don't you?
Ooh, okay.
Oof.
Well, that's okay, because technically it's a little bit grey. So they give us a letter of instruction that technically are asking us questions. Yeah. Like, what? I don't know. Would you say they're leading questions?
At times.
Sometimes,
yes.
Sometimes. But regardless, we kind of just tiptoe around that linguistic trickery. But I think the letter of instruction does give us the questions that we need to address.
Yeah.
But I think it would be very inappropriate if a solicitor said, hey, I want you to write an opinion where they are commercially unemployable.
Yeah.
Where, you know, they are able to work an administrative duty or something like that.
Yeah.
So that does not happen. I think it's more so that they ask, kind of relating to the claim, what would you say your opinion is on their real world capacity to complete XYZ job?
Like, as part of the critical thinking is you need to also understand from each material that we read, like, whose perspective is that coming from? And, you know, obviously someone like a plaintiff solicitor just wants to do right by their client and they want to achieve an outcome that's very favourable for them. So understandably, that may influence the way that they present information or put forth instructions, but it's up to us, and it comes with that skill set to be able to see down the line as to, well, what's that actually saying without the decoration on it? Like, what are they actually wanting, or what are they asking for?
Yeah. Particularly in the quantified amounts, I think, as well. And that's why they hire us, because we are the experts and we can answer those questions.
Here.
So that's the behind the scenes and a bit more of a discussion of the clinical experience behind medical legal OT.
So if you've ever wanted to reach out about what might be involved with medical legal OT, or if you think it might be a position that you want to look at in the future, please reach out, because we'd always love to have a chat.
And thank you so much for watching the OT download. We hope you can join us next time, that we have other episodes that you are more than welcome to flick back to, and we hope to see you next time.
Thanks.
Thanks for tuning in to episode 3 of the OT Download. Join us next time for episode 4, Better Together, how OTs and AHAs